So I would love to introduce Jason Haglund is a fifth generation Iowa farmer and co-owns the Boone County-based Hickory Grove Family Farm, LLC. Haglund's a behavioral health subject matter and systems expert based in Story City and develops and delivers educational trainings on suicide prevention, mental illness, addiction, behavioral health policy, prevention, and youth development. Currently, Haglund is serving as the Agriculture and Rural Specialty Coordinator for COVID Recovery Iowa, a FEMA response to the increased emotional and expected trauma responses many Iowans will experience as a result of the pandemic. Following Jason will be Danielle Day, and Danielle is a family life field specialist for Iowa State University Extension and Outreach. She facilitates learning experiences with professionals and community groups to promote healthy relationships, well-being, quality childcare, parenting, and caregiving. And following Danielle, Demi Johnson is a behavioral health program specialist for Iowa State University Extension and Outreach. She facilitates the planning, implementation, and evaluation of behavioral health programs for Iowa State Extension and Outreach. Welcome all of you, and thank you. And I think, Jason, you may be muted.
Well, thanks for having us. Demi, I thought you were kicking us off. It's great to be here.
Y'all go in whatever order you're comfortable with.
Don't worry,
Make sure you're unmuted.
We will ping pong around. And I encourage people to use the chat and be engaged with us. We certainly want to talk about the issues that are important to you. And we know that the impact, not just of the pandemic, but so many other things that have occurred over the last 18 months is really challenging. And so we just want to kind of have an open conversation with you all this morning, just about what your experience has been and how we can help to reframe that to our neighbors, our coworkers, and others in our communities, so we can help to find those linkages. And, one of the things I want to just take a minute and thank all of the veterans that just presented, all the veterans on the call for their service. I love to hear those stories as well. And I think all too often we don't take time out. And thank you. So thank all of you again for what you've done. So why don't you all take a minute and just put in the chat of the word stress is overdone. And, when I think of stress, I think of exhaustion. I think of being overloaded. I think of hopelessness. I think of grief. How many of you have experienced some of any of those emotions over the last 18 months? I mean, not just because of the pandemic. Across the Midwest, we had a derecho in 2020 that impacted so many people, especially the agricultural community. There's been ongoing financial worries. We've got some inflationary things happening. Global and political instability, cybersecurity attacks have shut down grain elevators. We have all of these things that are occurring around us that are just compounding the regular stressors. And I think if we think about the stressors specifically around agriculture, I can tell you that one of the things, there's things that I'm having to tackle right now that I've never had to tackle before. I'm not sitting in my office in my machine shed right now because it's full of totes of nutrients. And I've got pallets of things I'm going to need next spring. I've never warehoused my own chemicals and nutrients in my life. And right now I'm doing things that I never imagined that I would do. And so, as we think about, if you want to go to the next slide, Demi, the specific stressors that we might see around farming and agriculture or ranching, certainly we can think about livestock and the challenges in the cattle markets right now, the uncertainty, although prices were great, like I said, this year, next year, we're looking at much higher input costs. Farmers were really prepared for a pandemic better than anyone because they're already resilient and working in isolation. So that was all great because that wasn't a big disruption. However, there's some other loose connections that were connected with that of losing some other areas where they needed that social interaction. And so we think about all of those things combined. A lot of times in the agricultural sector, we're now seeing those increased stressors and those feelings of exhaustion creeping in. Just like we see burnout in lots of occupations, we also see burnout in the agricultural and farming community. I think it's really important that we figure out ways to talk about that and to talk about that stigma that comes along with it. So I've loved in the chat, as you talked about with veterans, that how stigma may be getting better. I see, because I'm looking at the chat while I talk about this. There's still a huge perception about talking openly about our emotional well-being. And so whether we want to call it brain health or mental health, getting an open and honest about how do we talk about this? How do we take care of ourselves? How do we start that conversation in a way that's supportive and understanding of others? Oh, I love this statistic. The way I start the conversation so oftentimes is I don't know how many people will follow the data coming out from the National Center for Health Statistics, but since the pandemic started, every 2 weeks, there's been a survey done. The key takeaway here is that top blue line. That's the number, and this is Iowa specific data. You can go to the website of the CDC and you can get data on any state, or you can look across the country. In Iowa, since last April, actually April 2020, when the pandemic started, to October 11th, the number of Iowans experiencing symptoms of anxiety and depression has never dropped below 25%. That's 1 in 4 of us are experiencing clinical anxiety and depression. It was as high as 44% in November of 2020. Prior to the pandemic, 11% of Iowans, that's our baseline, experienced symptoms of anxiety and depression. I share that because it helps us then to have conversations. It helps us to talk openly and honestly that a lot of folks are feeling off kilter. A lot of folks are feeling on edge. A lot of folks are probably acting a little differently at work or in the decisions that they make because of that increased anxiety and or depression. And so it really drives that conversation about stigma, that if we're not talking about this, then a lot of people are suffering in silence. So I try to kind of create it. And then I'm like, well, this has to be an uplifting, hopeful side to this, right? So I added the second line on there, and that's the number of individuals who are seeking therapy or medications. So people who have taken medications or sought therapy for their mental health condition in the last 4 weeks. I was hoping I'd see that line going up higher than it is. But the last reporting period through October 11th, it was the same, 27%. Now, it's not the same people, right? So just because 27% of people are going to therapy and taking medications, and that's 27% of all of us, right? It doesn't mean it's the same 27% that are suffering with anxiety and depression. And so we know that there's a lot of folks who we need to help create access to. And so I think that's access for everyone, especially specialty access for those pockets of populations who have greater, who are more at risk. One of the realities that we know is what happens when people are anxious and depressed, especially in rural communities. That's right. We tend to drink a little more. And so what we're seeing across all sectors, rural, urban, and other, is that we're seeing higher alcohol consumption. And so we can look at statistics across the country, especially in the Midwest. There's some uniqueness to the Midwest. I just saw another study that came out this morning here in the state of Iowa that binge drinking in Midwest states are much higher than the national average. And so, we need to think about what coping skills are we using and what coping skills do we see most utilized in rural communities. And unfortunately, it's not always the healthiest coping skills. And so you can think about, even for yourself, are you having a few more drinks at night than you were pre-pandemic? Generally, the answer is yes, unfortunately. And so we see a lot of different statistics and data that reinforce that. Anecdotally, when I'm out talking to folks across the state, or doing conferences like this, when I'm able to and have folks raise their hands and say, hey, are you having a few more drinks than you were? Generally, people are saying yes. As we think about where we're at, what we've experienced, the stressors of the pandemic, the way we're managing, it's okay to not be okay. And I think that's often a message that isn't discussed or isn't acknowledged, whether it's in our workplace or whether it's in our community. We should feel burned out sometimes, right? And so it may not be burnout. It may just be a sense of overwhelmed. It may be that exhaustion that occurs. But we should be experiencing ups and downs. It's when those ups and downs get really down and starts to impact our ability to function in all areas of our life that we really need to think about how do we get support and how do we acknowledge that and talk about it with others when they're having those extremes. But we should be feeling a lot right now, and it's okay to express those feelings. We see a lot of anger right now, and so part of that is just expressing all these feelings that people sometimes can't put words to, sometimes don't know what exactly they mean. I appreciate that physical health is directly tied to emotional health. So I see some folks in the chat talking about weight gain. We've all gained some weight, I'm afraid, during the course of this pandemic. I've joked at different times. For me, it's been the COVID-19, kind of like the college 10, right? I mean, it's part of that weight gain. It's part of that fatigue that we've all experienced is sometimes, it's just harder to do things. And I find myself struggling to come up with a menu, or my wife comes home from work and she's like, I'm done. What are we going to do? I don't know what we're going to do. What's for supper? And so, we eat out more, or we're ordering in more. All of those things come just because of this overwhelmed feeling that we've been carrying with us. And I do appreciate the other comment in the chat of who's been impacted throughout the pandemic, and absolutely women. Middle-aged women, middle-aged white women to be specific, are drinking significantly more than they were pre-pandemic. We also know that disproportionately emotionally, the toll of the pandemic has been on younger and women and minorities. So we've seen the impact emotionally much greater on women, especially the young, as we think about that 0 to 35 population being impacted. The very least impacted folks for this whole pandemic. Yeah, if you're over 50, white and male, only about 25% of them report being emotionally impacted by the pandemic. So it's really interesting to sit back and see who's been impacted and how are those folks supporting and understanding the realities of those populations who have been disproportionately impacted and struggling more than the rest of us. And I think that's part of this conversation, is to understand that some are struggling so much more. And what can we do to support them? What can we do to acknowledge the trauma that they're experiencing? And sometimes it's the trauma they came to into the pandemic. So some populations, such as veterans, part of what we do at COVID Recovery Iowa is we have specific outreach to veterans. Because it really does help when you have a veteran reaching out to a veteran to connect. And we know that population was more at risk going into the pandemic. And so we certainly are tuned into that because there's some very real concerns when we think about those at-risk populations and the compounding stressors that this pandemic has then placed on them. So I kind of talked about, those feelings of overwhelmed. Have you had trouble? Have you had that fogginess? I would love to hear, in the chat, if sometimes you just shut down of making too many decisions. I've kind of felt that way this fall a few times, of just having to make some decisions already about, what am I going to order for next spring? Is what I'm doing right now going to be available to me? prices are going up. Do I buy stuff now that I've never pre-purchased and then have to take, bring it on site and store it? All of those things are different. And so on top of all the other decisions I have to make, I'm now tasked with making choices that almost seem overwhelming. In my situation, I farm with my brother-in-law. So at least the two of us can talk about it. We're not solo. I'm not solo having to make those decisions alone. I have someone I can bounce it off with, but a lot of farmers are trying to make those decisions in isolation, and maybe not having the same support system they may have had prior to the pandemic. So I'd love to hear some examples of if you're seeing that, if you're seeing in your community, sometimes it's just a little harder to make decisions, or you may just kind of sit on stuff a little bit longer of just not being sure what's going to happen. I see somebody putting it in the chat. The multitasking has been stressful. I kind of wonder how many of you are multitasking right now, checking your email, doing something else, taking a phone call. It's so much easier, unfortunately, to multitask in this day and age where we're not completely present somewhere. We're kind of present in a lot of different places, but we're not really present anywhere. And I think that also takes a toll, because that constant multitasking just wears us out, and that just continues to perpetuate that decision fatigue. And that helps us sometimes, that causes us to be reckless in our decision making. Sometimes we just have too many options in front of us right now, and we just get stuck, analyzing everything and worrying about that. And so then we sometimes just go back to what we know, and that's not always the best thing. And so it's been hard. And so I think it's important just to acknowledge how difficult and how hard it has been. And to think about what can we do? Farmers are a resilient lot. I think about people who work in agriculture. I think about, the folks who farmers, the ranchers, livestock producers. There's been lots and ups and downs. And I think that we need to think about, how do we recognize our challenges? How do we help others to recognize their challenges? I think you can go to the next slide, Demi, if you'd like. And just think about what you can do to acknowledge that frustration and communicate those feelings and experiences to others, and do that in a way that promotes everyone's emotional health. And sometimes that's hard, right? Sometimes it's hard to set boundaries. Sometimes it's really hard to take time for yourself. I frequently challenge people. I ask, what are you doing for yourself? What is something you do that for, even just for 10 minutes, that's just for you, it's your own time. And oftentimes people are like, what? I'm not sure. It could be binging something on Netflix, or watching a show. It could be, some people meditate and do yoga. Some people go to the gym. But everybody needs that something that they do to recover. And so it kind of goes back to a sports psychology term I've been using more. I used to run, I still run, but I used to run a lot. And it's about recovery. And so I think about it as occupational recovery. Folks who are farmers and work in this sector, we have to recover every day so we can come back and make good decisions and do our work the next day. Many farmers and livestock producers, you don't get a day off. So every day you have to figure out, how do you build in time for yourself? How do you set some boundaries so you can take time off and rejuvenate yourself? But it's important we think about, how do we maintain our resilience? How do we build ourselves up so when those unexpected things happen? For me, last July, when that hailstorm came through and took out 60% of 200 acres of my beans, that was a tough day. I was on vacation and I could watch it from my security cameras. I needed to have some resilience built up, so that I could come back and make decisions about how are we going to manage that. What are we going to do for the rest of the growing season? And what steps can we take to minimize the damage to that? Danielle, you want to jump in?
Yeah, so now I'm going to share a little bit about what Iowa State's done, as well as other organizations. But sometimes people don't even know that they need help. or they don't think that their stress is possibly bad enough compared to anyone else. That comparison of mine's not that bad, so it's okay. So it's definitely not bad enough to warrant treatment. But we find that very common in the farming community. I don't have it that bad, but so-and-so has it worse. So Dr. David Brown with Iowa State University Extension and Outreach recognized that there was a need in 2018. And so he began implementing programs that focused on mental health literacy to help the average Joe and lay people connect with appropriate professionals and understand these terms. Mental health literacy, for a basic definition, is that knowledge and belief around mental health that aids in the recognition or management and prevention. So that working construct around mental health literacy is to ensure that people have that knowledge and they have the skill set to identify those common mental health challenges and disorders and identify what resources and treatment are even available, especially around their areas, because it might be different. So we've identified the many mental health challenges and barriers to treatment that farmers and ranchers face. But now we're going to kind of shift into how increasing that mental health literacy in farm advocates and farm families can help reduce farmer suicide. So there's really 3 primary programs that Iowa State University Extension and Outreach is offering in response to farm stress with the goal of increasing mental health literacy. And these are the Stress on the Farm. There's actually 2 programs under this heading. We have Stress on the Farm Strategies to Help and Stress on the Farm Strategies to Help Each Other. We also have Question, Persuade, Refer, otherwise known as QPR, and Mental Health First Aid. And there's a curriculum for adults and a curriculum for adults assisting young people. So additionally, Iowa State University Extension and Outreach is one of 5 organizations that helps with the COVID Recovery Iowa outreach efforts. And each of these organizations really specializes on a unique sector of Iowa's population. And so Iowa State University has really specialized in that farm and ranch outreach. So a little bit about the Stress on the Farm programs. As I shared earlier, there's 2 programs. The first one, Stress on the Farm Strategies That Help, was really introduced at ag meetings, either in beginning of 2018, 2019, kind of those initial reactions. And it focused on checking your own stress, understanding your own stress responses, recognizing your own signs of stress. What are some strategies you can do to cope with stress? How can you potentially help others recognize those same ones that you're recognizing? And where can you find resources? And so it was a basic 30 to 40 minute presentation that was really added on to other agricultural programs that were already happening, and there was going to be an audience. Stress on the Farm Strategies to Help Each Other was a 40-minute program on suicide prevention, and that was actually initially offered at over 95 Farm Bill meetings between fall of 2019 and beginning of 2020, pre-pandemic. And it was really focused on introducing a simple model where we could walk through scenarios and how you could help somebody recognize signs and then get some help. We had over 4,000 participants in the Farm Bill meeting presentations. Both of these are great additions when there's already going to be an agricultural audience together talking about a topic they want to talk about. And it's always great to introduce some of that stress conversation when they're already there for another meeting. And then we have question, persuade, refer. And this is a 1-hour suicide gatekeeper training that we initially started wanting to offer face-to-face. And quickly, as soon as we were all trained, the pandemic hit. And we couldn't offer face-to-face programming, but we recognized that there was such a need for this program with everything that was going on. And so we implemented the virtual 1-hour trainings at different times throughout the day to really reach the audience where we could. And we had over 700 participants, almost 800, in 78 sessions since April of 2020. And so in those 18 months, we really expanded our grant-funded audiences to include faith leaders in the communities, rural youth professionals like 4-H or FFA staff. And QPR is specifically, we created one specifically designed for those agribusiness professionals like ag lenders or those that are going to be interacting with our farming audience. Dr. Brown from Iowa State University Extension and Outreach and his team are with the North Central region are actually going to discuss some additional target audiences and identify kind of how they came up with things and the role that they're playing in protecting farmers and ranchers later on. And so mental health first aid teaches you how to identify, understand, and respond to signs of mental illness and substance use disorders. This training gives you the skills that you need to reach out and provide initial support to someone who may be developing a mental health challenge or a substance use problem. And it teaches you how to connect them with the appropriate care. So we also know that young adults can experience mental health challenges and addiction challenges as well. And so the course, Youth Mental Health First Aid, introduces those common mental health challenges that youth might be experiencing and reviews some typical adolescent behavior and when you might want to be concerned. And so you learn a 5-step action plan for how to help young people both in crisis and non-crisis situations. And so both of these classes can be taught virtually or in person. And we have classes going on kind of continually throughout the year.
Sorry, I was just reading Ralph's message in chat, and it made me think that doctor could have used some of these programs. All right, so I get the easy part. I kind of get to drive us home here. So Jason chatted about why we're talking about farm stress and why it matters and who's experiencing it. Danielle was able to talk a little bit about the programs that we're offering. And I'm really just going to kind of end this with how we expanded our efforts and why. So again, thanks to that USDA NIFA grant, it's allowed us to offer our programs for free for those who support farm families in addition to farmers and farm families. So we've expanded our instructor team across Iowa as well for those face-to-face programs, especially in the private businesses and private groups that have been requesting face-to-face programs. So in the last year, we went from only 3 QPR trained instructors to 10 trained instructors across the state to easily serve all of Iowans, and continue to offer those programs for non-traditional agribusiness support systems, such as faith-based community leaders. And we added 2 Spanish-speaking instructors to be able to offer these programs in Spanish for our farm workers as well that only speak Spanish. And then additionally, our mental health team has continued to grow over the last few years. So we started with just 2 trained instructors in I think the end of 2018. And we now have over 15 instructors. And these are all folks from different professions within ISU, Extension and Outreach. And so some of our instructors come from ag and natural resources, and some come from our 4-H programming, and then some of them are human sciences staff. So they are each able to bring just a unique perspective and background to the table as they present the curriculum and relate to the audience members. And so like Danielle mentioned, and like I just mentioned, we've been able to expand our reach through offering these programs to a variety of targeted audiences, including agriculture, but also high-risk professionals and adults that work with youth. And we're now just kind of dabbling into faith communities and Spanish-speaking communities as well. And so some of the folks that are on this list and the slide have been a part of our outreach efforts, like Keep Hearing Mental Health First Aid. And then others on this have been some of the folks that we have been working closely with our COVID Recovery Iowa presentations. Farmers, farmer producers and families, agriculture producers, professionals like federal, state government, physical, mental health professionals, commodity groups, agribility, 4-H, all of these people are able to take our programs for free right now, just trying to really build that connected system kind of around our farm families. That way, as they disclose information or concerns, somebody is connected to them. They are part of that conversation, but they also know which resources are available for them. And they're able to respond appropriately and help connect them as needed. So some of the resources that we share at all of our presentations, of course, is our Iowa Concern Hotline. This is really kind of meant to be a non-crisis resource, but if someone comes to you experiencing financial, legal, they're experiencing stress or talking about a crisis or disaster response, that's where our Iowa Concern Hotline is really able to connect folks to the resources that they need. Additionally, Iowa Concern is not limited to only Iowans. Our hotline staff do answer for out-of-state folks as well and maintain some of the different resources from out-of-state. Jason, you want to talk more about COVID Recovery Iowa?
Yeah, so COVID Recovery Iowa is that are the resources available from FEMA to the Iowa Department of Human Services during the time of a presidential disaster declaration. And so we've had a prolonged presidential disaster declaration for both, originally the pandemic, and we continue with funding from FEMA to provide kind of an additional layer of supports in addition to what that infrastructure within your local community is. So because there is such high levels of anxiety, depression, substance use, problem drinking, the list goes on and on. This is kind of that extra layer. And so, we're very lucky to have partners like Iowa State University Extension Outreach and the work that Dr. Brown is doing, because it really dovetails into helping us then to guide people to these resources and programs that can assist them in gaining that further education so that they can educate and decrease stigma and talk about this in their local community. So we can be accessed online at covidrecovery.org or through the Iowa Concern Hotline that you just heard about. So, both of those are ways. We're also, have spent a lot of this being virtual. And so I think that that's part of the conversation. Now, just because it says COVID Recovery Iowa doesn't mean it has to be about COVID. A lot of the stressors that are happening may be as a result of other types of COVID disruptions. And I think that's part of, the difficulty we've seen in some rural areas is there has been disruptions. And so sometimes that's kind of like a domino effect. And so we just want to recognize the stress that domino effect has on folks. We also, need to recognize the reality that more people in rural communities have died from COVID-19. And so statistically, there are some greater impacts across those communities. Emotionally, sometimes, though, there aren't as great of impacts that urban areas have been impacted as well. And so I see some stuff in the chat about that. So it's been a very unique situation, unlike any other disaster response I've been part of. I've stood along the Missouri River talking with farmers and looking across that valley at grain bins that were completely submerged and land that they never knew would be able to be farmed again. This is a different type of disaster. It's been prolonged. It's gone on for much longer. And so we're going to be around for a while, helping to connect folks, connect to the programs that Iowa State does, connect to other resources. There's a new, Demi, you talked about in the chat, what could a doctor's office hand out? Dr. Brown just came out with it. There's a new extension document that kind of guides you through, how do I find a therapist? What do I do? It's a great piece that Iowa State just put together that's now available on their website. If you go to that, I don't know if that link went directly to that new piece or not. But those are really useful things to have. And so using extension for those resources that help guide people through and navigate the system. And that's really what we are at COVID Recovery Iowa. We help folks to navigate through the system because sometimes it can be challenging. It's not necessarily always easy to find assistance for our emotional health and well-being. And so we want to make sure that that process is as easy as possible for folks. And, there's probably no one better suited to do that than the call center at the Iowa Concern Hotline. It's 1985 for a reason. It was 1985 that the farm crisis that I remember when I was young impacted my family. And when my dad went bankrupt. So, although the stressors are very different today, it's still a very stressful occupation to be a part of. In addition to COVID Recovery Iowa, I kind of talked about that every state and territory was under a presidential disaster declaration at some point for the pandemic. Some of our partners, this is Region 7 of FEMA. I was lucky enough to be to do a presentation like this with our FEMA partners in Region 7. And so we're part of Kansas, which their program is Together Strong. Missouri is a Show Me Hope, and I think they're under a disaster declaration for their tornadoes that ravaged southern Missouri. And then Nebraska Strong is kind of a sister program to what we're doing and their pandemic response across the state of Nebraska. So there's many initiatives going on that's above and beyond your state's regular safety net right now, where people can find additional resources, navigation, and crisis counseling to help guide people back to resources or to help navigate those resources so that you can find other ways to support people during these challenging times. With that, I would love to take questions, kind of hear what you're thinking. Part of what we do is lead conversations and talk with folks about what's working in other areas, how folks have been impacted, sometimes how folks haven't been impacted. There's lots of emotions around this subject right now. There's lots of emotions around how do we support each other. And we know that emotional health and stigma, it's almost the first thing that people talk about when I go somewhere. I kind of walk around talking about what we do. And so it's always interesting to hear what you're doing in your community to decrease stigma, or what you're doing in your community to educate others, so that these conversations are maybe a little bit easier to have when you need to have a tough conversation with someone because you're concerned they might be having thoughts of suicide. That's the benefits of QPR and mental health first aid. It puts those scenarios, and stress on the farm, it gives you those scenarios where you can think about how are you going to talk about it, what are you going to do, and it's so important to practice those things. And that's really the great opportunity you have with some of these programs, is to start gaining that knowledge before you have to have those difficult conversations with others. So is there any evidence that the pandemic is reducing the stigma of mental health? I'm not sure if it's the pandemic or it's a generational perspective. We know that younger generations are much more open to discussing their challenges and what their expectations are for, especially, I do a lot of work in workplaces. And so, there's a big challenge in corporate workplaces right now of how do we create emotionally healthy workplaces? Because I can tell you those under the age of 30 have a very different expectation for what a workplace should look like, what it should feel like, how an employer should support them emotionally than our older workforces. And so that's been challenging at times. So I think that there's a generational shift in how we address emotional well-being, of how we talk about well-being, of kind of how we intersect self-care with resiliency, with occupational recovery. Those concepts are much more clearly articulated by our younger generations than by those who are, say, over age 50. So I do see some changes in that way. More anecdotally, I could probably find some research for you on that, but we've seen a lot of those shifts in the workplace, and that has a lot to do about creating an emotionally healthy space for folks. Danielle and Demi, you guys are welcome to jump in.
I think I just might add too that the pandemic kind of caused a collective thing to be stressed out about. And so I think it kind of gave people a platform to describe what they were feeling and feel connected to one another. And so that kind of ties back to one of the chats earlier about somebody finding a Facebook group where they were sharing how stressed out they were about having kids along on the farm chores and whatnot. And so finding that group and that support system to be able to talk about your experiences, I think has really helped. And because so many people were affected by COVID-19, it was easier to find that group in that space to be able to have those conversations about those experiences.
Yeah, and I mean, COVID was a collective stressor that everyone experienced. So we're all able to identify together that we had something, and it brought to light everyone can experience mental health challenges, and it's okay to talk about them because we need to talk about them. So I think the younger generation has done really great about showing us it's okay to talk about mental health. And I do think that it is really something that's coming to light and people are getting more and more open to talk about. So I look forward to seeing where it goes in the next coming years.
Yeah, a lot more of the conversation has shifted from we've all experienced a collective trauma. That's what a disaster is. And the only way that some would say you can heal from a collective trauma is through collective healing. And so really that's communities coming together. And so I think uniquely, one of the things that has been missing as we think about the traditional phases of a disaster is that collective healing. That's part of, what Midwesterners do. You come together after a disaster. And so there hasn't been that sense of community coming together in some areas. And so I think that's been the challenge of healing as we move forward. And I think that's part of the reason we're having more conversations about our emotional health as well, because this has been a longer, more prolonged stress that has resulted in trauma for some. And so when we think about compounding traumas of others who have trauma histories, then this is just one more on top of that longer list. And so then that results in sometimes a more difficult road moving forward. And so that's where having extra resources, finding support systems is really important.
It doesn't look like any more questions are coming in through the chat. But our contact information is not on here. At any point, if you have any questions or concerns or you want to reach out, I think we can all be reached in one way or another through the Iowa Concern Hotline if really needed.
Yeah, and there's lots of opportunities to learn more, to bring these types of programs to your workplace. That's something that more and more folks are doing. And so I encourage you to think about how can you bring those programs to your community? How can you host and support those types of initiatives that help to decrease stigma? If you're not impacted, that's probably true, but remember that 25% of people have been, at least, if not much higher. And so when you look around the room, there's probably folks who are being impacted that you may not know they're struggling as much as they have been. So think about what you can do to be that person that helps to create a platform so that they can be more open and maybe find the supports that they need during a difficult time.
Well, thank you so much, Jason, Danielle, and Demi, for for this excellent presentation. And I think we know that although you're all located in Iowa, talking about collective trauma and collective healing, that should resonate across the country and probably the world at this point. So thank you for bringing the important work that you're doing in the Midwest to us. And with that, we will move on to our next roundtable. And this roundtable is the collaborative extension efforts to deliver farm stress programs in the North Central region. And we have a wonderful, wonderful group of presenters. I am going to go ahead and I will introduce our convener, Dr. David N. Brown. And then what I will do is I will put the bios for those who are presenting into the chat, so everyone has an opportunity to see those, but I'm not taking valuable time to introduce this wonderful panel. You can read a little bit more about them, and they are sure welcome to introduce themselves prior to their presentations. So Dr. David Brown is a licensed marital and family therapist and currently serves as the behavioral health state specialist for Iowa State University Extension and Outreach. Dr. Brown leads various grant-funded projects involving stress assistance programming to farmers, ranchers, and their advocates. Involving mental health literacy, suicide prevention, and crisis counseling and outreach services related to COVID-19 pandemics. So with that, welcome panel and welcome Dr. Brown.
Thanks so much, Ellen, and thanks everyone for being here today. I also want to thank our veterans who are out there serving. I have the opportunity to be a behavioral health provider to the military for about 5.5 years of my career, and I have the utmost respect for those who are serving and those who have served. So again, thank you all for your service on this Veterans Day. Our roundtable today features some information about collaborative extension efforts to deliver farm stress programming in the North Central region. And you will hear briefly from each of our presenters as they provide information related to the 5 key components within the North Central Farm and Ranch Stress Assistance Center. And those key components include training programs, professional behavioral health services, clearinghouse website and webinar, telephone helplines, and support groups. And so following those real brief presentations, we'll have an opportunity, each of our presenters will have the opportunity to answer questions directly related to the provision of these services. Again, my name is David Brown. I'd like to have our other presenters in order of the slide if they would like to introduce themselves as well.
David, I'm not certain that everybody's on there. There's been a couple people who have asked for the panelist invitation to be resent. So I think there's a few people that aren't able to get on just yet.
I think everybody's on right now.
Okay, perfect.
So Josie, you want to go ahead?
Yeah, absolutely. Good morning. Thank you for having us. I'm Josie Dolphy. I'm an assistant professor and extension specialist at the University of Illinois. I'm excited to talk to you today about the North Central Farm and Ranch Stress Assistance Center.
Good morning, everyone. It's really an honor to be here with you today. I'm Dr. Courtney Cuthbertson. I'm an assistant professor and extension specialist in human development and family studies, also at the University of Illinois.
Karen, do you want to go next?
Sure. Karen Funkenbush, and I'm an extension specialist at the University of Missouri Extension.
Tammy Jacobs, and I am an extension specialist with Iowa State University Extension and Outreach, and I supervise the hotlines, including Iowa Concern Hotline.
And finally, good morning, everybody. I'm Athena Ramos. I'm at the University of Nebraska Medical Center in the College of Public Health, Department of Health Promotion, and work with the Central State Center for Agricultural Safety and Health.
Yeah, thank you all for being with us today. We're going to go ahead and move on with the presentation.
I'm going to go ahead and start us off. So really appreciated the presentation right before this. I think Jason did a really nice job describing some of the stressors that are commonly cited among agricultural producers in the Midwest. And in addition to knowing that producers experience really unique occupational stressors, we also know that agricultural producers have worse mental health than the general population. That's typically characterized by higher rates or prevalences of depression, anxiety, and suicide in when compared to the general population. So, for example, in 2019, it was estimated that 17.3 million adults in the U.S. had at least major depressive episode, or approximately 7.1% of the general population. And based on some surveys of producers in the Midwest, we know that this episodes of depression range from 6 to 50%, so significantly higher than the general population. And what we see in terms of anxiety are very similar. Rates in the general population, or I should say prevalence in the general population, somewhere around 20 to 25%. And estimates among agricultural producers are somewhere between 27 and 71%. So very similar to, again, like the presentation before us. We know these comparisons have to be interpreted with some caution. They're certainly not perfect. The methodologies were different. In some cases, the instruments are different. There's certainly converging evidence that farmers, ranchers, agricultural producers, and their families experience really unique occupational stressors, which have impact on their mental health. Thank you. Recognizing the stress and mental health experiences of farmers and ranchers, the 2018 Farm Bill provided language for farm stress management resources through farm and ranch stress assistance networks. And USDA funded 4 regional programs, originally in 2019 and again in 2020. The North Central region, which includes the 12 states you can see on this slide, formed the Farm and Ranch Stress Assistance Center. We have partnerships with 15 organizations in all 12 states. And our goal is to initiate, expand, and deliver farm stress and mental health resources and services to producers, workers, and families in our region. We work within the 5 USDA priority areas. Those are listed here on the slide. They include training programs, telephone helplines, clearinghouse website and webinars, support groups, and professional behavioral health services. And today we're going to talk in depth about each of these 5 priority areas.
Okay, I'm going to start talking a little bit about the training programs that are offered through the North Central Farm and Ranch Stress Assistance Center. Now, some of those you've already heard a little bit, quite a bit about, so I'm just going to touch on those. One of the programs offered by a number of states is mental health first aid. Other states are also providing question, persuade, refer. Certainly Iowa State is. But there are some other programs I think we need to mention as well. One program is titled Communicating with Farmers Under Stress. This was developed at Michigan State University. And this is a program for agricultural professionals who work with farmers and their families. We know that ag professionals may wish to help, but may not be sure what to say or what to do. And so this workshop helps participants recognize signs of stress and learns techniques for identifying, approaching, and recognize and working with farmers who may be experiencing a burden of extraordinary stressors. Another program also developed at Michigan State is a program titled Weathering the Storm. This is a curriculum that is designed for farmers and can be taught one-on-one or in group settings. It focuses on providing tools for the farmers and their families to help them through difficult situations. Now, a number of states are also providing, working on programs that focus on helping others learn more about the culture of agriculture. Iowa State's developing Relationships Can Heal, knowing the farmer client. I know University of Illinois is also developing a program, but it's all about teaching healthcare and mental health professionals more about the agriculture profession so they are able to better work with their farmer clients and those involved with agriculture. Many of the different programs are also involved in interest groups, and which are kind of key ways for participants from all the states to talk about regional needs, potentially joint program evaluation, and sharing of program ideas and resources with each other. And one of those is the Mental Health and Suicide Prevention Interest Group. What I want to talk a little bit about all of the work that's been done just in the last fiscal year. And again, the USDA NIFA grant was secured by Drs. Josie Rudolphi and Courtney Cuthbertson, who are here today. We started doing the Mental Health and Suicide Prevention Interest Group, which meets quarterly. But we've had throughout the 12 states a lot of participants trained. We had 446 trained in mental health first aid, 398 in youth mental health first aid, 127 participants in QPR, 343 participants in communicating with farmers under stress, and 341 in weathering the storm. So that's a huge number of farmers and farm advocates that have been impacted through programming, training programs associated with this project. Part of what's going on now, we're also having a lot of discussions on regional evaluations, how we can kind of use the expertise within the 12-state region to have a really good data set and showing our impact. And we think through all of these projects that lives have been saved. Now I'm going to turn it now over to Karen Funkebush from the University of Missouri.
I hope I can talk today. I have laryngitis, so I'm going to try to do my best. In addition to providing all of the training programs that David previously indicated, I also want to take a few minutes to share how the University of Missouri Extension is helping farmers, ranchers, and their families increase their access to professional behavioral health services. By partnering with the University of Missouri Psychological Services Clinic, that's located on the MU campus through our College of Arts and Science, we are able to provide what's called the Skills for Psychological Recovery Farm Stress Program. This program consists of 5 teletherapy sessions. They're provided and trained by their trained counselors, and they are helping our farmers, ranchers, and their families cope with anxiety and stress. The Skills for Psychological Recovery, this is an evidence-based program. It's individually tailored, and it's a brief intervention. And this intervention means it's from one service up to 5 counseling sessions. The focus is on how we would help them strengthening their coping skills to manage stress, building resilience, and also supporting good behavioral health that they need to adjust in the face of acute and long-term crises. Because of our USDA NIFA grant, we are able to provide this service. If it wouldn't have been for this service, we wouldn't have been able to provide it. This service is free to all farmers and ranchers, regardless of what type of insurance they have, or even if they're unable to pay. What we do know and understand right now is that this service is actually being accessed. Our farmers are using it mostly by women. Women are coming and wanting to do longer than the 5 sessions that are provided. It's interesting to find out that our men, on the other hand, want to go through 1 session, they've been fixed, and now they're ready to move on. And that's probably pretty common with a lot of our men. But again, we offer the 1 to 5 sessions, and what we know and understand that from what our farmers are telling us, that because of this access to this free teletherapy session, it is helping remove at least one source of worry for them.
Another key component of our efforts include the Clearinghouse website and the various webinars that we've been able to offer. The idea with the Clearinghouse website, I heard a panelist earlier say, it'd be really nice if there was just one place we could go where we can get all of the information and be able to go from there. So that was really our goal. And the website is farmstress.org. This is the North Central Farm and Ranch Stress Assistance Center's Clearinghouse website of different resources that might be able to help. It is, and thank you, Josie, for adding that in the chat. The website includes a little bit of information about the group and the effort, different resources by state in the North Central region, and then a searchable database of different kinds of resources and some resources that are available if someone is experiencing a crisis or needs help immediately. Certainly, if you're perusing the website and you can think of another resource that's not there, feel free to reach out. We would love to keep adding to this because we know new things are constantly emerging. The website also houses our archived newsletters. We've been publishing a monthly newsletter since November of last year, and we'd love for you to join that listserv if you would like to. In every newsletter, we include an update from Josie and me, and we include an update from one of our collaborators, a new resource that we've been made aware of, and then we like to highlight those partners that we know are doing good work within our region. And thanks again, Josie, for adding the information about the newsletter in the chat. So please click on that link if you'd like to join. With the webinars that we're offering, we do at least 4 a year, and the National Agribility Project has been very helpful in being able to really put these webinars together and offer them. You can see in 2021 the various topics that were covered. We had an overview of the Farm and Ranch Stress Assistance Network. We have had a webinar about different stressors and resources related to farm and ranch families with disabilities. There was another webinar about African-American farmers, and the fourth one you can see here is about migrant or seasonal farm workers and the different stressors that come up. So we've been able to reach a lot of people with those webinars and be able to get out really good information. The next webinar coming up will be Tuesday, November 30th, and the topic for that webinar, I will put the registration link in the chat. The topic for that webinar is strategies to prevent farm and ranch suicides and for assisting suicide survivors. So those family members and friends, community members who have lost someone to suicide. So our hope in providing the webinars is that we're able to spread more information about farm stress and what people can do to help. And I'm adding that into the chat now.
So the Iowa Concern is part of this program as being one of the hotlines that are available for any of the collaborative states to utilize for farm stress. Our hotlines are available all days, all hours, so 24 hours a day, 7 days a week. The hotlines actually, I think somebody, I'm not sure it was Demi or Jason talked earlier about it, did start in 1985 with the farm crisis. And it is available for every state in the United States. So not just these 12 states, but we really focus on making sure that the partner states have the capability and ability for anybody to reach out to us. We also have live chat, email an expert, which can be reached at the Iowa Concern Hotline website, and also texting is available. When somebody calls into the hotline, they're going to get confidential help. We may ask for their zip code just so we know what state they're calling from or what county. But other than that, we're pretty confidential, and we don't ask for any other identifying information unless that person decides to give it to us, or we need to connect them to a program that's in their specific area through one of the counseling programs of the state. All of our staff are trained professionals. They all have a 4-year degree in human sciences and or equivalent with education and experience. A few of the things that we offer on the Iowa Concern Hotline is stress counseling. We're not a suicide prevention hotline. If we get a caller who is suicidal, we're going to get them to a safe place and then get them sent on to somebody who is more trained in that area, who can help them more. But we're going to help them to find those tools in their tool belt to help to decrease the stressful situations that they're encountering and help them to be able to move on. We also partner with extensions and outreach financial education specialists for any kind of financial concerns to help them with one-to-one budgeting. We also have partnerships with the Ag and Natural Resources, where if they need to have a FinPack for financial resources done regarding their farm business, we can connect them with that. We do have attorneys on staff to provide legal education. Our attorneys don't represent, they don't advise, but they can help provide them with information and education about their legal rights and responsibilities. As was mentioned earlier, we do a lot of stuff with disaster recovery. We're currently a partner with COVID Recovery Iowa, and any other disasters that are generally in the state. We're one of the primary hotlines that are activated at that time. We provide a lot of information and referral to different resources to help individuals. It could be something for food, it could be rent assistance, it could be counseling services. We got a pretty large plethora of a resource database, so we can provide information to different entities to provide those resources. The Iowa Concern Hotline number is 1-800-447-1985. And I'm just going to share a little video about the Iowa Concern Hotline so you guys can get a little gist and feel of what the Iowa Concern Hotline is all about.
Sometimes life gives you a lot to handle. But you don't have to handle everything on your own. Iowa Concern is a free service connecting Iowans with information to help them navigate through a variety of life circumstances. We provide assistance over the phone, through our live chat service, and through email. When life gets tough, we are here to help.
So I'm going to share a little bit of information about one of the support groups that is funded through our collaboration, and that's called Bienvenido. So Bienvenido is an educational strengths-based curriculum that really focuses on well-being and the adjustment and integration of newcomers into a community. And so we're actually implementing this program with immigrant and migrant farm workers throughout the region. We try to help participants to have a better quality of life and to develop some more of the strengths that help them to reduce some of the risk, the emotional risk, and the behaviors that are associated with poor mental health. And so Bienvenido is actually a program that was created by a gentleman named Gilberto Perez. And it is one of those programs that's defined by SAMHSA as a community-defined evidence-based practice. And so it focuses on 3 general areas, and you can see all of the 9 lessons and the objectives of each of the 9 lessons. But when we talk about this program, we try to talk about focus and trying to help people to become more conscious of the feelings and the thoughts that they have related to being in a new place with new people. Maybe that's unfamiliar to them. And to recognize that their life experiences up to this date are going to have an impact on what they're doing in the present. And to recognize that we all need a place to be able to talk openly and to reflect on our experiences and about that process of adaptation. It's also a program to help participants attain new knowledge and to become acquainted with the community and with the resources that are actually physically present in the community, and to hopefully identify some opportunities that they can engage in community life. And finally, with vocation, we try to help participants put into action everything that they've learned and to give them some practical steps for improving their emotional well-being. And as I mentioned, there's 9 lessons in the program. Typically, the program is conducted with 1 session per week. In our case, in trying this out with migrant farm workers over the past summer, we had to condense the lessons into 5 sessions. And we did those over a period of 3 weeks, given the time constraints with the corn detasseling season. Next slide. And so with our program, we had 36 participants who started out with the program. We had 29 who actually completed the 5 sessions. Now, I tell you this because I think this is really exceptional. We were really excited to have that many people complete the program. We actually facilitated this program in the evenings after work. So after people have spent their whole day out in the fields from 5 a.m. to 5, 6, 7, 8 o'clock at night, we're waiting for them in the parking lot of the place where they were living to run this program with them. And so to have 29 people who completed the program, we were very excited about this. So we did this in a very low resource type of setting. We provided food, and we also provided a cash incentive for people to participate. So originally, I think the cash incentive was the draw to participate in the program, but I think people walked away with a lot more than they were anticipating at the beginning. So we did see that there was a decrease in alcohol use from pre-test to post-test with our participants. And really the goal of this program for this past summer was to try it out, to pilot test it, and to see how it goes and what are some adaptations that we need to make, because eventually we'd like to scale this program throughout the North Central region. So we got a lot of positive feedback on the program. People enjoyed it. They made new friends. They got to know their coworkers a little bit better. They really liked the discussion and the group interaction. And this was a place where they actually felt like home. The program was conducted in Spanish. And they felt like the facilitators really made some of these concepts easy for them to understand. The class was late in the evening. We recognized that. And so sometimes it felt like we were kind of rushing through some of the material to try to get people off to bed. And people recognized that. And they were a little bit sad that it had to be over so quickly. And here you can see a quote from one of the participants on the bottom. I appreciate what you do for people and keep at it. A lot of people don't know or don't understand what mental health is. And thanks to you, I now know better what it is. I can now manage my problems better. So some of the things that we learned from this program are that we need to include more agriculturally relevant types of examples as we facilitate the program, and make sure that the program is done in a very highly interactive manner, given the time constraints that we have with the program and running it after the working day. We would love to spread the sessions out over more time instead of condensing them into that 3-week period. And so we're hoping to work better with ag employers so that we can get a better understanding for the time schedule, so that we can plan a schedule that's going to work for the program, for participants, and also for the employers. And we also learned that we need to have more resources that are not just place-based, and so not just geographically based, but also recognize that a lot of these people are coming from other countries. And so it's nice to have a broad understanding of what are some of the resources all along the migration route. So from Mexico, in our case, all these workers were from Mexico, to understanding their specific communities or states in Mexico, and all the way up through Nebraska. So it was a great experience. We're really excited to be able to disseminate and facilitate these support groups as part of this collaboration.
I want to thank all of our presenters, just talking about the exceptional work that's being done with this project. And I really want to thank Drs. Rodolfi and Cuthbertson, because they're really the individuals that make it happen. They're managing the project for us, and they've just done an amazing job getting the funding, securing the funding, and maintaining it, so we can continue to provide these exceptional programs and provide the information to the agriculture community. What we're going to do now is we're going to kind of change our venue a little bit. And what we're going to start doing now is we're going to ask the presenters if they want to kind of respond to some questions that we're going to put up on our slides. And it focuses on some of the key areas that they just discussed. So I'm going to kind of read the question and just open it up to our presenters. Also, if the audience would like to put some questions in the chat box, we'll try to respond to those as well. So our first question for our panel is, what has been the response of the agriculture communities to the programs and resources you've been offering through this effort?
Well, I can go first. I think I gave you a little bit of that on the last slide. In terms of the farm worker response to this program, they were very excited about the program. But on the other nonprofit organization partner side, I can tell you there's also been a great response, because oftentimes we go to our nonprofit partners and we say, hey, we need you to help us find people. We want to do a study. And we do a study. And we may share the results back with them. We do share the results back with them, but they're looking for things, programs, tangible things that they can take back to their communities. And so they've been very excited with the Bienvenido program, because this is one of those tangible things that we're giving back to the community. So we're not just going in to go collect our data and write our papers, but we're actually giving back to the farm workers who have given so much to us. And so our partners are very excited about the Bienvenido program. They're also very excited about the availability of the QPR program, the mental health first aid, the youth mental health first aid, and all of the Michigan State curriculums, and those things being available in Spanish, because we see there's a great need for those types of resources here within the Midwest.
Who else would like to respond?
I'll take it. You want to go, Josie? Okay, I'll take a few minutes to say, piggyback what you just said, Athena. QPR in Missouri has been a huge success. I mean, we have our professionals across the state of Missouri who are very interested in taking the QPR and become a gatekeeper. And I think that's because it's a 1 hour session. And so that has been a huge deal in Missouri. The other thing that has been a huge deal has been the Weathering the Storm. That has gone over very well. That's a program that initially the University of Missouri, as a part of our plan, we weren't going to be engaged in that activity. But after we have 10 people trained, cross-disciplinary trained to do the Weathering the Storm and communicating with farmers under stress. And that cross-disciplinary team consists of like 4-H, food nutrition, human and family sciences, and then our ag folks. So we never ever, and I think Athena may have been the one that just brought this up, because this is an ag-related initiative here in Missouri, like what Athena just said, we want to keep it ag-based and ag-related. So our ag folks are teaming up with our 4-H, they've teamed up with our food and nutrition, and they've also teamed up with our human family science folks, because they may not have a strong background in agriculture. So when the agricultural related scenarios or issues come up, that is actually facilitated by our ag specialists.
And I can speak to a little bit of what we've experienced in Illinois. I think this is an area that's been ignored for a while. So we have a lot of support and buy-in from a lot of the commodity groups. We've pulled together an advisory board, and we sit on a couple of other advisory boards. And I think the demand for, like Athena and Karen were saying, programming and resources is very much there. And so we're working to make sure that our partners in Illinois and across the North Central region have the resources as they need them. I think the Clearinghouse website is one example. It's an online resource bank of sorts. It can be very, utilized anonymously, which is important for some in agriculture. There's still, we've talked about stigma in the previous presentation. So, and then we also have wallet cards. And so we can be very sort of forthright in offering resources to people who may wander to a booth that we have somewhere. I think of the Farm Progress Show as an example. People who are proactive in getting resources, we can meet their needs as well. And so I think that's one of the important points of the center, is that we're trying to offer resources and programs to producers, workers, and their families as they want them, realizing that everyone's in a different place. Some people aren't ready for maybe professional behavioral health services. When they are, those will be available, or when they are ready, those might be available. But trying to make sure that people have resources, like I said, as they want them.
And I can talk a little bit about the Iowa Concern Hotline. And, one of the things that I have really noticed is the growth of information that's available in the other states, the partner states, and the services that are available. And those are great to be able to have available for callers. As far as impact that we have had, we don't really get a lot of information back unless it's negative information from callers who have had a bad experience, which doesn't happen very often. But we actually did get a couple of responses back to Dr. John Lawrence that two individuals in the farming community had actually reached out to the Iowa Concern hotline. And because of the resources available, because there was somebody there to visit with them to talk about the stress that they were experiencing, both of the individuals expressed that calling into the hotlines actually saved their life. So the work that we are doing and the effort that's being provided is definitely well worth what we're doing.
One of the things I'm going to add, I don't know if I can top Tammy's story as far as impact, but we've not only had, I think, good response with the agriculture communities, but also with partners within our states. And I know many of the state extension services are now partnering also with their state departments of agriculture to provide even more services on stress assistance programming to the communities. And that's another great partnership and response that we've had, just the ability to reach out even more to the agriculture communities with services and programs. And I think that we need to talk about how this program has just allowed us to build on other things as well. And there's a couple questions in the chat box. One I think is for you, Athena, and it says a machismo factor related to how much farm workers express about stress and emotional health.
I would say yes. Machismo is definitely a component of trying to talk about and manage emotional health and well-being. So machismo is more around these traditional gender norms of masculinity and trying to be tough and to not show weakness. It's now being conceptualized in the literature as having two components: more of this traditional machismo, which is more framed in that negative light, and a more positive version of machismo called caballerismo, which is more of being a gentleman, taking care of your family, trying to be tough, but yet recognizing that, you're responsible for a lot of people. And so I would say, yes, it is part of this effort. And that's part of the reason why we wanted to use the Bienvenido program, because it's more of an open discussion. Like, it isn't, you have to come to class and we're going to teach you about emotional health and call it emotional health. No, we're not going to talk about that. We want to, this is a dialogue. Like, everybody is learning from everybody else in the group. And I think keeping it more of a support group format, more of a dialogue and conversation, is really critical to engaging farm workers in these types of programs. I think talking about it as mental health, or even emotional health for that matter, isn't always the right phrasing to attract people and to get them to participate in our programs.
Thanks so much, Dr. Ramos. Hey, we have another question in the chat box, and I know one of our questions we have down the road here was about stigma, but there's a question for the panelists. I'm wondering if the pandemic has reduced the stigma to talk about it more openly. And so I'll throw that out, because we did have a question built in as well, but let's talk about stigma now. Has the pandemic opened up more conversations about mental health and other issues?
Well, I think it was mentioned in the previous panel, this is, COVID-19 is something we all experienced. And so there was an opportunity to have collective or shared trauma or stress. And as a result, perhaps the door is open a little bit. And it's a little bit more welcoming to have conversations in a much bigger group about mental health and stress, because it's something we've all experienced. And I think we see examples of that. I think the derecho is another good example, if you can call it a good example of anything. But there was a group of people who experienced, tremendous crop loss. And when there were meetings, whether they be crop insurance meetings or other types of production meetings, it was an opportunity to sort of collectively acknowledge what everyone was going through, and then create a really safe space for people to perhaps share individual experiences, or at least like communally commiserate, which I think there is some value in sometimes.
And I think the other thing that the pandemic has done in a response to COVID is provided more opportunities for telehealth. And having that telehealth opportunity helps decrease the stigma, because then that person does not have to drive to a facility, be seen walking into the facility. So it takes that stigma away there. It also offers more opportunity for being able to take less time to go to a therapy appointment. I've talked to many people who are like, yeah, I could be in my combine, I could be in my tractor and being on a telehealth call, and I didn't have to, stop, get cleaned up, go into town. And so it was less of a time commitment as well. So that's not really decreasing the stigma, but I think just the opportunity to not have to be seen at a mental health counseling facility has really decreased that stigma as well.
Yeah, I want to echo some things, Tammy, that you just said, and also what Jenna just put in the chat box. I do think that the telehealth is going to be a game changer because you can do it any place, anywhere, anytime, and it's very convenient. The thing that we need to be cautious about when you're looking at telehealth, though, is making sure that you're getting the credible and counselor that has the reputation and knows and understands not only telehealth counseling, but also understands the culture and the beliefs and the world of agriculture, because we would hate to have our farmers get into the wrong hands and be provided a service that may or may not be applicable to them. And so that's what we have found. We have found that in Missouri, the telehealth has been the way to go, and it has helped a little bit to remove the stigma. But I have found that at the state fair, where I did see and hear men, on the other hand, bragging about how they did go and are participating in the telehealth sessions.
And to kind of piggyback off of that, Karen, one of the things that we have found in the last many years is historically there's been more professionals in the mental health area who have that ag background. But more recently, we don't have a lot of those professionals. So with being able to use telehealth, that kind of opens it up a little bit. So it might be somebody who's available 3 hours away from you who's got that knowledge, which makes it a lot more readily available to do a session via telehealth. So that's another really good thing that's come in regards, not many things have come out of COVID, but there has been a few good things that have come out of COVID. So I like to look at those positive things.
And if you look at the chat box, they said that the farmers are more willing to do a telehealth visit from their tractor. So, doing it from any place, anywhere. What a good use of the time while they're combining or whatever they're doing out in the field. So, what a great resource for farmers to have it when they have the time to do it. I'm going to move on to the next question. Many people are interested in helping agriculture producers. How have you collaborated with other agencies and organizations? And I talked a little bit about the collaboration between the state departments of agriculture. But I'm going to open that up again. What other agencies have you partnered with or collaborated related to this project?
I'll jump in, David, for this one. And I'm only going to mention a couple. In Missouri, we have a committee that's called Show Me Farm Safety. And so that committee consists of stakeholders, ag stakeholders. And it's been surprising to see how they have all embraced looking at mental health. And that committee consists of folks like the Missouri Department of Ag, Workforce Development, Department of Elementary and Secondary Education, Cattlemen's Association, some of the other Soybean Association, corn growers, University of Missouri Extension, our Department of Mental Health and Human Services. The group that has jumped in the most has been our Department of Mental Health. And they have two branches that have helped us. One of them is our veteran services. And so we have a lot of veterans that we're currently working with that are farmers. And so having them at the table has really opened up a door for us to provide some of the programs that you mentioned, David. So like the QPR, the mental health first aid, the weathering the storm, and then the communicating with farmers under stress. that's been a huge asset. And then the other group has been our Department of Mental Health. And so they have a branch that's called Prevention of Suicide, David, which you mentioned earlier. They have come on board and have provided us a ton of free services. I think that is the beauty of the North Central region, is that we don't have to do this alone, that we have a region that really has embraced working and helping our farmers and ranchers who are going through some tough times. So I don't ever have to reinvent the wheel. If I need something or want something, I can pick up the phone, I can call my other colleagues, and they are there to help, and they are there to help guide, and they are there to help direct. So it's the same with our Department of Mental Health. They have given us thousands of dollars of free resources and free posters and free placards, all types of stuff that we are able to then disseminate out into our rural ag communities.
Well, through our farm worker interests group, we are trying to provide a number of these programs throughout the North Central region in Spanish. And so we have been collaborating with the migrant education programs, with the Department of Labor at the state level, also with the National Farm Worker Jobs Programs affiliates, to be able to provide these services, because we hear oftentimes that, the programs exist, but the staff would really like to have the information in Spanish because they're going to be delivering it to the communities in Spanish. And so we've actually been, for example, we did a training for Proteus's staff on QPR earlier in the spring. We also have done mental health first aid and youth mental health first aid for the migrant education recruiters. So for all the program recruiters who are out there interacting with families and individuals, they wanted to do this program and learn a little bit more so that they can identify the signs and symptoms of mental health with the people that they're interacting with. And so those have been some of the key collaborators, I would say, for the farm worker interest group.
Josie spoke earlier to some of our other collaborating agencies and organizations here in Illinois. We've been collaborating with some different commodity groups, with different county and state level farm bureau organizations, Department of Agriculture, and there is an effort through Southern Illinois University School of Medicine called the Farm Family Resource Initiative that provides different kinds of resources across the state of Illinois. So we've been able to really work to cross-promote each other's efforts, to co-offer different programs and share information about what we know is going on in the state, which has been very helpful. As new opportunities come up, we're able to work together on those things. So Josie, I don't know if there's anything else in Illinois that you would want to mention.
No, but I would add, we represent, I think, four of the 12 states that are working as part of the North Central Farm and Ranch Stress Assistance Center. So if you are, if anybody who's joining us today is interested in getting engaged with the state effort in their state, feel free to contact me, or I'm going to offer Courtney as well. We'd be happy to connect you to our key network collaborators in those states so that you can either become engaged or learn more about what's happening in the state where you're operating.
Thanks so much. I'm going to go ahead and move on to the next question. And the next question is, again, the stigma. And maybe we'll go ahead and go to we've already kind of addressed stigma. So let's move on to the next one.
Well, David, I do have one other thing I'd like to add on that, if that's okay.
Certainly, go ahead.
So I think one thing that is really important in dealing with stigma, I do think the pandemic has made people more willing to engage in these conversations. And I think there are two things that have helped in dealing with stigma. One is showing up where people already are. So how can we add a presentation or some kind of information, hand out a pamphlet, a brochure, a wallet card, whatever it is, wherever people already will be. So that way it reduces barriers to access to information. And there's another point that I just wanted to highlight again that Dr. Ramos brought up around language and how do we have these conversations and how do we talk about this? So whenever I am on a panel like this or doing a presentation or doing some of these outreach activities, and I know others in our region do this as well, I try to change the language and the conversation around mental health. That phrase mental health is so much broader than depression, anxiety, and suicide risk. So the things that I try to always communicate are all of us have mental health all the time. And we can think about our mental health being on a spectrum, really, from poor mental health to excellent mental health. And we all need supports for that. What those supports look like are different depending on where on that spectrum we might be. So being able to talk about mental health that way, as this is something we all have all the time, I think helps to break that down a little bit so that people are more comfortable thinking about themselves and thinking about their own mental health. Because I do think that the stigma makes it very uncomfortable for people to consider themselves in these conversations. So thanks for letting me share that.
No, thank you. I just want to also add, I remember a couple of years ago, I was doing a farm stress presentation. Imagine that at a Practical Farmers of Iowa conference. And so I sat down with a group of farmers to have some lunch, and one of the farmers I knew, and he told me something very interesting. He said for the first time in his life, he's actually started to hear farmers talk about stress. And so the more these programs become available, the more they hear about their availability, I think we are beginning to really open up those conversations and provide that information to them. And so I think some of that stigma is maybe waning a little bit just because it's such a big part of all the work that many of the universities are doing and other projects are doing. And so I'm hoping we're having an impact there. And this is a question for all of us again, and that is, what would you recommend other people do to support when we're about done? I tell you, take that back. We have about 3 minutes, so I'm not sure if we're going to have time to do that. So I just want to see if there's any other information in the chat box. We have some comments. Young people and young producers seem way more open to discussing. I think we would probably all agree with that. Dr. Cuthbertson's put her information there. And there's a question for you, Dr. Cuthbertson, in the chat box, if you want to address that right before we go.
Yes, I see the question of whether we work with rural nursing and doctor initiatives to give grants for people attending medical school or nursing and then going to work in underserved communities. So in Illinois, we are connected to 2 different programs that do that type of work, although we're not directly involved. I think that speaks to how important it is to have those different collaborations because we can't all do all the things as much as we would like to. We also need to sleep and be human beings. So it's really, really great that we can be connected with people who specialize in different kinds of programs and all work together because we have this common goal of wanting people in the agricultural community to experience the best mental health that they can. So I'm just really appreciative for all of the collaborative efforts that we can engage in.
All right. I guess I want to thank all of the presenters and all the participants with us today to able to share some of the great works going on in the North Central region to impact farmers and farm families, hopefully make their lives better and saving lives as well. So I'll turn it back over to the MRASH team.
Oh, thank you. And thank you all for another great panel discussion. This, once again, let those of us know who need these resources where to find them and where to direct our people when we are doing outreach or even research, and better understand how we can help our constituents. So thank you again for a fantastic presentation, and y'all get a gold star for ending on time. So expect to find that in the mail, okay? Thank you. So we now have about 15 minutes to get to the next link. I have put that in your chat box. We do have to move. We're moving on to the meeting platform, which allows a little bit more interaction. And our next presentations will be on that platform. So please, as you find that link, go ahead and switch over, and then take the next 15 minutes to practice some mental health practices as well as physical health. Get up and stretch, walk around. It's been a great morning, and I know we've all been glued to our screens, so this would be a good time to kind of reflect on some ways of taking some self-care. So thank you again to our panelists, and please, if you haven't checked out their bios before you go, check out the bios in the link that was shared. Thank you, and see you on the other side.